HHS and the Department of Defense is also working with media and entertainment industry to try to reduce misleading and inaccurate depictions of behavioral health conditions and of people seeking care, with some special emphasis on military personnel. And DOJ, the Department of Justice, and HHS are partnering to try to further develop veterans treatment courts. The Administration on Children and Families, which is also an agency within HHS, is working on making child care more available in 13 states where military installations are there, and also partnering with the VA and the American Bar Association to address child support issues for homeless veterans. Interestingly enough, child support issues is one of the top issues for veterans who are homeless. They're also trying to increase access to DV services, domestic violence services, and also to try to identify and make access available to Head Start for military families who have young children. The Administration on Children and Families is also working with the National Guard and the Veterans Administration on a compensated work therapy program to ensure that information about child support is also available. This issue of child support is a very big issue, and I think it is a challenge for employers, whether you have a veteran who has child support issues or a non-veteran who has those issues. Within SAMHSA itself, the Substance Abuse and Mental Health Services Administration, I will first want to recognize our Center Director for Mental Health Services, Catherine Power, who's with us today, and she also leads 2 initiatives that we're working on, one of which is focused around military families, and the other is focused around recovery, and I want to talk just briefly about both of those. One, the Military Families Initiative is really trying to do several things. We're trying to improve access to health and behavioral health care to military families of all sorts. Many times people who are in the military, either deployed or veterans, have access to some things, Veterans Administration, TRICARE, other kinds of health and behavioral health care. There are times when military families don't want to use that care. They want to use regular health and behavioral health care providers. So we're trying to make sure in partnership that we make those opportunities available in all those places. We're also trying to make sure, as I said earlier, that those providers understand military culture and what that may bring to the treatment process. We're also trying to work on the issues, I said, of suicide, and also trying to just work around building emotional health, resilience, and prevention activities within military families, because we know that children of deployed military have bigger health and behavioral health issues. Spouses have bigger issues, as has been discussed already. We also know that we've got a lot of people coming back from the military with issues such as post-traumatic stress disorder, with substance abuse issues, with traumatic brain injury, and other kinds of challenges. And a lot of people who have those don't get help, and for those who do get help, a lot of them don't get high-quality help. So one of the things that we're trying to do is improve that access and also improve the quality of the services that they have available to them. We're working a lot on the issue of trauma-informed care, trying to make sure that as people enter care, that the people who are providing that service to them, whether it's in an EAP or whether it's in regular behavioral health care or whether it's in health, primary care, understand that trauma that people have experienced, whether trauma as children or trauma as adults, especially for military who've experienced the trauma of deployment. Those bring special challenges to treatment and special challenges for HR professionals who are working with healthcare providers and insurers to provide that care. We also have an initiative around recovery, and I want to say just a word about this because we've been working on the issue of how we define recovery. And interestingly enough, the concept of recovery, where we're talking about behavioral health in a healthcare context, is really talking about a process of change where people take some and have some responsibility to develop their own health and well-being in a meaningful life situation in a community that supports them in that process. There is both a construct of returning and restoration, as well as a construct of going beyond in the notion of recovery. And interestingly enough, I think that's very similar to returning vets, in both in returning to what they, a life that's not military, but also in going beyond that experience and bringing that experience with them. So as we're doing that, we're trying to figure out how we can help with resilience and restoration, as well as people taking responsibility and having responsibility and being able to get the resources they need to take care of themselves in that process. I think the one thing we're also trying to work on, and I think it's very relevant for this, is changing the conversation about behavioral health, which is one of the biggest challenges. But let me put it to you this way. I think that the veterans that you're going to hire, the warriors coming back, in some ways have no different challenges than all of your employees. They're going to have challenges around health and behavioral health access. 3/4 of the people in our country who have problems with alcohol are working, so they're in your workforce now. A lot of the people, most of the people who experience depression are in the workforce. You're dealing with them as employers, and you're supporting them as employers. These military professionals coming back have child care issues. They have unique child care issues from the deployments that they've had and the separation from family. They have family issues, whether it's domestic violence issues or divorce issues or issues of paying the bills or making ends meet. They have training and career development issues that are specific, and they have child support issues. So in some ways, as I started thinking about the issue of what's the challenges for veterans in returning and getting employment, well, clearly there's the challenge of getting employed, but I think as an employer, your challenge is very similar to your challenge for any employers, any employees, which is to support them with their needs and look at the skills they bring. The people coming back from deployment have some very special skills, however. They come back with commitment and leadership and skills around problem solving and a sense of teamwork unlike anybody that you're going to hire. Those are skills that I, as an employer, would want to have in anybody that I hire. So I think figuring out a way to take advantage of and recognizing those as some of the most important skills is critical. As employers think about hiring people with mental health and substance abuse issues, or I think sometimes people don't want to do that. They're afraid they're taking on something that has bigger implications. I think what we're trying to do at SAMHSA is try to help people understand that prevention and treatment and recovery for people with behavioral health issues should be viewed as a public health issue, just like somebody who has diabetes or hypertension or any other chronic illness. And frankly, the proportion of the people in the United States, most of which are working, have some kind of chronic condition, and it's a matter of how employers work to support their workforce to get both the skills they need from them, but also support them going forward. So we're trying to think about how to do that as a public health issue, not as a problem. We'd like to translate these issues from problems of homelessness and problems of behavioral health issues and problems of violence and other kinds of perceptions about people with mental health and substance abuse disorders or their needs. And we are trying to look at embracing military personnel and their family members as a valued part of our nation's communities, and that's what this summit is all about. And returning military personnel and their family members without a job or without a place to live or without a community that embraces them or without adequate health or behavioral health care is unacceptable. And I think that's what we're all trying to make the commitment to do. You can and are making that difference. I'm very impressed with this work and the effort that you're going through today. And again, on behalf of Secretary Sebelius and all of HHS, and particularly on behalf of SAMHSA, we have lots of resources and commitment that we can do to help you, and anything that we can provide, we'd be happy to do that. We also have a website, samhsa.gov, www.samhsa.gov, ccarecore.gov. We have materials, resources, and phone numbers and things that we can provide, and anybody who has issues that face those particular challenges around substance abuse and mental health, we're happy to help, or we're happy to be a conduit to anything else within HHS that we can help with, whether it's child care issues or child support issues or anything of that nature. So thank you for having us, Dr. Lehrer, and we're really pleased to be here.
Thanks for the comments, and I think it reminds us of a number of things, which is the totality of the issue, that it's not a single issue. Wounded doesn't mean a physical injury necessarily. The definition is quite broad. It doesn't mean just finding a job for this woman or man who comes back, but taking care of the family. And it doesn't end when you find them a job, because they have unique issues, but also very similar issues to those others in our employment. So that it's a commitment to the family and to the entire process, and I think what you say reminds us of that. Sometimes it's very easy to create a very narrow focus, which at the end of the day won't be successful. It's got to represent the total care needs. So thank you for your comments. Let me turn it over to Eli Wahesh, who comes from CareCore, who also has a perspective on this, both as an employer and I think a personal perspective. Eli?
Thank you, Dr. Lehrer. I decided to leave the military in 2006. And at the time, I thought about it and I said, I'm going to give myself a year, and it's going to be pretty easy. I was in the Army 10 and a half years. I was recently promoted early to major. I got to witness the country pre-9/11 for 5 years in the military, and in post-9/11 watching an incredible appreciation for our military grow. So I thought to myself, I've accomplished a lot of incredible things in the Army. I picked up many skills. As a part of the 75th Ranger Regiment, I was a fire support coordinator, and I would help plan complex helicopter raids, parachute assaults, deployed 5 times to both Iraq and Afghanistan, witnessed things that would make the news that day, and said, when I get a civilian job, it'll just be easy. I'll be able to tell them all of this, and they'll hire me, and I'll do something. So I was going to spend a year figuring out what's out there for me, and it was very difficult. At the end of my year, 2007, when I left the service, I decided, well, I'll get my business degree. So I went to Duke University for my MBA, and while I was there, I told myself again, I'm going to discover what's out there. What are the industries about? What positions are available, and most importantly, what value can I contribute to an organization, because I wanted to be successful and I wanted my employer to have value from my skills. I was able to narrow it down with the help of peers and the programs at Duke, but it was still incredibly difficult to communicate the value of my experience to an employer. And I think as the governor stated, a lot of HR departments don't have that experience. So when you sit in a room for an interview and they ask you, have you ever been in a difficult situation, there were so many of them, I didn't know which one to pull. And then I'm thinking, well, I don't want to make someone feel uncomfortable by telling a story. So it took a while for me to realize that I had to understand the industry. I had to understand what a company in the healthcare industry was all about, and what were the positions and the responsibilities within that company where I could feel value. And it didn't take long once I realized that, but it did take a lot of experience with people who were in that field. So when I found out about Hero Health Hire, I said, this is perfect, because if you get out there if you get out there while they're searching, while they're still, I'm going to get out of the military sometime soon, and you explain to them, this is the healthcare industry, and these are the components, and these are the roles and responsibilities. Now let me hear a little bit about you, so we could find where your value is needed in our organization. At CareCore, I work with about 9 other combat vets, and they're in positions ranging from director to executive vice president. And let me tell you, the value of it is, you could see it before your eyes in our organization. We brought in a former Army helicopter pilot and told her, you're going to be responsible for our radiation therapy program. She had zero healthcare experience and zero medical experience, maybe going to a doctor. That's about it. Within 2 weeks, she sat down and explained all the different cancer treatment types that we manage. She explained to me things I didn't even know about the intricacies of the cancer treatment and the codes that are associated with the cancer treatment and how our program worked and the value we provided our client within 2 weeks. And now she's taken ownership of that program and she's growing it and she's refining it and she's bringing incredible value to CareCore National.